So, could you explain to us what the previous situation was in Egypt and why this organization had to be changed?
In fact, the previous situation of blood transfusion in Egypt was very poor. It was very primitive and very fragmented because it was based on small hospital-based blood banks in all the hospitals. And these small blood banks used to just collect the blood from either family donors or from professional donors, and they used to do very poor quality testing or very, very poor or even nil blood products. And because the other health services grew very much in Egypt, like the oncology treatment, like open heart surgery, organ transplantation, bone marrow transplantation. So the government of Egypt realized that this blood services is very much poor for the health services. And they decided that they have to improve it and they have to restructure it and do something about it.
Okay, and how did this implementation start?
It started in 1997 when the ex-Minister of Health decided to do a twinning with another country, which is Switzerland in our case, for the know-how transfer. And we started a project between Egypt and Switzerland, which we call it Restructuring of Blood Services. And this project based on a plan, a long-term plan in two phases. One phase started from 1999 until 2003, and the second phase started from 2005 until 2011. The main objectives of this plan is to reorganize the existing facility and the existing infrastructure to become regionalized, and in each governorate we have a regional blood bank that is the sole provider of blood in the country, and to convert all the hospital-based blood banks into storage facility. The main element of this project is to upgrade and develop the human resource, because once you have a very well-trained human resource that are capable of handling this service, you will maintain and you will sustain this. So the human resource was a main element that was really supported by international experts, and we created a team of national calibers or specialists to train others. Another element is to have appropriate use of blood program, voluntary donation program, IT program as well, and it is really a very complicated plan, but it is going on well. Yes.
Okay. So thank you for this explanation.
Thank you.
Could you tell what was the main difficulties to organize this breakthrough?
It was really difficult because you know, people they really naturally hate change, and especially the health authority people in the Ministry of Health. They thought that this change or this upgrade is going to threaten their positions and it's going to take the control from them. And the main resistance was from inside the health authority, and the resistance is they didn't want really to implement the program, they didn't want to accept the new policy and the new standards. But we were in the blood service, we were very persistent and we were very determined to implement. And we thought that if we make quick results and quick successful results, it will be credible and it will show them that it's for their own good. And we made one pilot in only one area, one governorate. And this pilot really was very successful and it had the echo in other parts of the country. So this main resistance was now overcome. The second resistance was from the public, because people were used that blood comes from only professional donors whom you pay them money to donate blood, or from the family members whom they are keen to help their patient. And this is another challenge, another resistance to create a new culture in the country and in the society that normal people, normal healthy people should donate blood regularly. The rest of the resistance are really manageable.
Okay.
Yes.
And what are the main advantages of this new organization? I mean, quality, safety, traceability of the blood donation.
Yeah, there are many advantages that we feel it in Egypt, and that gives even the encouragement to the government to really support the remaining of this plan. The main advantages is that the blood collection was more increased from the donors, as well the quality of the blood, because the testing of these blood donations was done centrally in every governorate, and you can of course follow up the quality. You can have audit system, you can have external quality control system. So quality, the quantity of the blood was more. And another advantage is the cost. We used to cost more, each unit of blood, it used to cost more because it was processed in a small scale. So the cost was too much before, and the quality was very poor. Now the quality is very high and the cost is less, because we are processing bulk. We are processing now millions, not like tens or hundreds like before. Another advantage is the users of the blood. I mean the clinicians who use the blood. Now they know how to use components, they know the indications, the contraindications, and they know how to bring the right component to the right patient in the right situation. So many advantages. As well, something else. The people who used to work in the blood banks, they used to really think that they are in the worst part of the health institutions. And they used to just be like transit in the blood bank until they find another job somewhere else as internal medicine or trauma doctor or trauma technicians or whatever. Now people like to stay in the blood transfusion service, like to work in the blood bank, because they find proper training, they find better career prospects and better chances for improvement.